It's in India, it's in China, in Italy, in South Africa, Venezuela, Jamaica, United States, and as you can see from this map, in many more countries all over the world. Chikungunya or CHIKV is a viral disease transmitted by mosquitoes. It was not common to the Americas. In fact, it was in December of 2013 that CHIKV was first reported in this region in the Caribbean.
Chikungunya was primarily documented in the African continent, but there had been sporadic imported cases to the Americas, including the US. But there had not been any sustained transmission, so that countries would have had a national epidemic. Now I believe you can consider it to be an endemic disease.
Dr. Marvin Manzanero is currently the head of the epidemiology unit of the Ministry of Health, who have been closely monitoring the situation of CHIKV.
It is transmitted by two mosquitoes, Aedes aegypti, Aedes albopictus, same transmitters of the dengue virus. So with globalization, urbanization, it is expected that chikungunya, along with other viral diseases, will start to come about. So this is something of what we call re-emerging and emerging infections affecting most countries.
Is it possible that there are cases in Belize that perhaps have not been confirmed?
It is possible. Chikungunya may not necessarily take everybody to a hospital setting. So it could have been that there could have been a case and the patient didn't make it to the health facility. I mean, that's a possibility. We are trying to establish epidemiological links. We have had 6 suspect cases reported to us by both private and public sector. We haven't had any confirmed case. Yesterday, the Ministry of Health got a call about a potential imported case from El Salvador, and we are doing case investigation yesterday and today. That could be our index case. That could be the first case that is not locally transmitted, but it's imported, but that can give rise to a local transmission.
The symptoms of chikungunya are very similar to dengue, with a sudden onset of fever, rash, and joint pain. The joint pain is described as the main difference between CHIKV and dengue. The name chikungunya traces back to Africa, and it means that which bends.
The pain might be so severe that people walk in a bent or a kind of crouching position associated to the joint pain. And also it's how long the joint pain lasts. It can be 2-3 weeks. It's not necessarily going to kill you then, but it can make you very sick. And for example, we're looking at cases in El Salvador where they're reporting a lot of economic losses associated to people not going to work as a result of chikungunya. In some instances up to 3 weeks. So when you start doing the math, that is where perhaps it can affect not just the Ministry of Health in terms of resources, because there's no treatment, but in terms of days lost. And I think that will be a concern for employers, for Social Security Board, if it hits Belize the way it has hit other countries. So that's why it hasn't fallen off the radar. And because of the chronicity it can have in terms of the joint pain, it can be much more prolonged than dengue, so the person might be unable to work for a longer period than somebody who has had dengue.
There is no specific treatment or cure for CHIKV. Symptoms would be treated individually. The joint pain, though, can last for a few weeks, a few months, or a few years. There are rapid tests available in the private sector. However, these tests are simply not sensitive enough for a proper diagnosis. Therefore, a follow-up test has to be conducted. This is done by sending the samples out of the country for confirmation.
I think the more important thing is establishing an epidemiological link. If you have been to an area where there's ongoing transmission of chikungunya, then that's an area of concern for us. If you have not moved, let's say, outside of Belize, outside Belize City, and there are hotspots in Belize City for dengue, then the first thing we have to think of is dengue, not chikungunya. But if you have been to El Salvador, Guatemala, on the western portion of Guatemala primarily, Caribbean countries, then you should be considered for chikungunya, and you should be able to pass that information on to your clinician so that we can establish the link.
But even with the proper vector control, Belizeans should still be a bit more cautious of their environments. And if you do develop symptoms, report to your nearest healthcare facility. Although it is only a matter of time before we confirm our first case, given the time of year, Belize may fare off well, at least for 2014.
I don't think we will have that many. We are almost at the end of the rainy season. We are almost at the end of where dengue usually peaks in the year. So I think we will follow the same pattern. We might have a bigger problem in the years to come, but I don't think we will have a problem this year. Try to avoid mosquitoes in as much as you can using insect repellents, long sleeves. Trying to be in an area where you're not exposed to the mosquitoes, which are usually more active in the early hours of the morning, break of dawn, at dusk, in the early hours of the evening, and the first couple of hours of night. And I think primarily it's having a clean yard.